All right, I am going to go ahead and get us set up for our next presentation, which will be starting promptly at 10:25 Eastern Time. And that's going to be Dr. Timothy Dougherty, who's going to talk to us about vaping and asthma. So Dr. Dougherty, if you want to go ahead and get your slides shared, we can get started with your intro and presentation, and then make sure you'll have your camera on and your microphone on. Unmute yourself in the Zoom to be able to speak. So while Dr. Dougherty is getting set up, oh, great, I'm seeing your slides, perfect. While Dr. Dougherty is getting set up, I will give a brief introduction to him. So you can see the bio in your pamphlet. Dr. Timothy Dougherty is the Medical Director of Cape Coral Emergency Physicians and the Medical Director of Lee Health Emergency Management. So certainly Lee Health has been an amazing partner for the Florida Asthma Coalition over the years. And we are very privileged to have a number of folks from Lee working with us. In education, Dr. Dougherty has worked at Allegheny University of the Health Sciences and also helped to found the Health Opportunities Prevention and Education curriculum at Jefferson Medical College. So welcome, Dr. Dougherty.
Thank you. Can you hear me?
Yes, I can hear you and I can see you.
Okay, perfect. So welcome everyone. So today I was asked to talk about vaping. And the reason why I said you come a long way, baby, I was first asked by to speak back in 2015 on how e-cigarettes are affecting respiratory patients. And back then it was just starting, and we'll see where we, if we've been able to answer any questions from that time to this. Again, I just wanted for clarification, I want to make it clear that I'm not a pulmonologist, that I'm actually an emergency physician and a medical toxicologist. So that is my background and training and my interest in e-cigarettes and everything that potentially you can vape because of it. So I have to learn how to do, okay, I got the buttons now. Okay, so back in the 1970s, there was a very successful campaign by Virginia Slims to try to encourage women to start smoking cigarettes and increase their market share. Jump 50 years, and some things actually still haven't changed. So the question of the day is vaping safe? And I'll go through the presentation, and I think that the best way to do it is have you make those decisions on whether or not that you think it's safe for you or your patients, and use this as an educational piece. The other part that I do want to say is I have no financial disclosures to make on anything that I'm going to say about e-cigarettes, any of their components or treatments. So what are e-cigarettes? So e-cigarettes were designed to deliver vapor nicotine for absorption through the respiratory tract through non-combustible means. It was developed by a gentleman a pharmacist in China in 2003. Basically, it was related to a family member who had died of lung cancer and wanted to find a more safer means of still allowing people to, quote, enjoy nicotine that didn't require all of the other components that were in regular cigarettes. It was introduced in China in 2004, in Europe in 2006, and the United States in 2007. Interestingly enough, Philip Morris actually had conducted experiments in the early 1990s on this capability, but they actually shelved their research because they thought it would hurt their tobacco industry too much. Well, jump forward, currently it's a $4 billion annual market share and a $15 billion worldwide. So what's the definition of an e-cigarette? It's a little complicated, but I'll still read it. It's an electronic device that delivers nicotine or substances to a person inhaling from the device, including, but not limited to, electronic cigarettes, cigar, pipe, hookah, any or including any component, part, or accessory of such a device, whether or not sold separately. So that's the actual definition, but what does that actually mean? So another way of looking at it, they refer to it as ENDS, or the electronic nicotine delivery systems. And it can come as an e-cigarette, e-pen, e-pipes, e-hookahs, and e-cigars. How does it work? So if you look on your screen from your right to your left, you have the cartridge that contains the solution, and that solution has the ingredients, so in this case nicotine, which then has to get dissolved. And the two main components that people are used to dissolve is either vegetable glycerin or propylene glycol, and we'll talk a little bit more about those two substances later on. Then you have a heating cartridge that heats up the vapor. Almost all of them now have a microprocessor to control the heat, and an LED. Then you have the battery pack, and then usually for an e-cigarette, you have something on the other end to make it simulate and look like a cigarette. So a green or blue light or red light will light up at the end of the cigarette when you take a draw. It's not part of this talk, but I do want to say that there's been, when we talk about health risks, there have been several times that the microprocessor has malfunctioned, or the battery has leaked, that has resulted into explosions, and people have lost their fingers, partial of their face, third-degree burns when it's in their pocket. So there are complications of just actually holding on to these devices based on the manufacturer's ability to still maintain the integrity of what it was intended for. The newer models actually have if you look on the right-hand side, you can see that now some of them, you can actually have your own, it doesn't come pre-filled, you can have your own refilling reservoirs, you can mix different liquids to get your flavor just right that you like. You can also choose which temperature of the vape you want to manage. And some people feel strongly it has to be at a certain temperature to get the maximum effect. So I guess one of the other questions is, well, why is it so popular? Well, is there power in marketing? I can tell you, and before I want to go, I will say that for those who are interested in the marketing aspect of e-cigarettes, if you go to Stanford's education site and just type in Stanford e-cigarette advertising, they have a whole entire site that is devoted to a collection of every type of advertising that has been occurring for e-cigarettes, and group them by category. So if you ever have to give a lecture, if you ever have to educate other people, it would be a great site to use for some of the questionable advertising techniques that were used in the past. Some have since been closed down by the FDA, but some are still going on right now. And when we talk about advertising, we're not just talking about print ads, or obviously the ability to do things on TV, but through YouTube, through Twitter, through other things. So this is one of the ads that actually they were using, and you can see that they also initially were really advertising as this is a safe alternative to cigarettes, that you can do it around your kids and you can blow in their face, and they love to see the smoke, the vaping mist come at them, and it's perfectly fine. And actually now, they're actually even now really creating mixed messages, because somehow they're connecting you purchasing e-cigarette solutions or pens, and you think that you're actually helping with cancer treatment by smoking e-cigarettes. So again, on the right-hand side, you see you can't buy happiness, but you can buy e-cigarettes, and that's kind of the same thing. So exposure to e-cigarette ads back in 2011, just in 3 years, jumped 256%. And these ads solely were targeted at the time, because it was legal, to the youth age between 12 and 17 years old. An 8% of online audience of e-cigarette ads is estimated to be younger than 18 years old. So one of the claims and advertisers that they had is use e-cigarettes. It will allow you to stop smoking traditional cigarettes and just switch over to e-cigarettes. Well, they've been too long. This slide is a little bit old, but this slide at the time had 2 longitudinal studies involved in multiple nations, and found that e-cigarettes was not associated with quitting of conventional cigarettes. Then the second one found there was significantly less quitting. And since then, there's been other longitudinal studies that have looked at it, that there are still plenty of people that are smoking both regular cigarettes and e-cigarettes, depending on the restrictions or where they are. And there has been also associations of people going from e-cigarettes to tobacco cigarettes. So again, on the right-hand side, if you can't stop smoking, cancer will, but if you buy and smoke with stream e-cigarettes, cancer will not. Well, I'm not sure 100% that that's actually going to be, obviously it scares you. But again, I think that, does that make it safe to smoke, to vape e-cigarettes? We certainly know it doesn't help quit smoking. And studies over 2 years have looked at that, and so far have not been able to show any evidence that actually that occurs. So there has been a rise in popularity. Twitter had over 200 million posts advocating vaping cigarettes, and greater than 80% of those were actually created by bots. And we're going to get into it in a second, but part of the rise in population is all the multiple flavors that are out there. And in addition to that, the technology has improved to make it more attractive. So now chargers that you don't have to worry about keep plugging it in if you're out and about, these chargers will last up to 500 puffs. And they're advertising a cost savings that you can save 50% of your budget on cigarettes over a year by switching over to e-cigarettes. So every year, the Department of Health and Human Resources looks at this, and the National Youth Tobacco Survey, and they're looking at high school students. Again, we're just purely looking at high school students, and I'm going to explain why that's kind of important. High school students, the use of e-cigarettes continue to decline. Now you can see that on the far left, as you go down in years, or from 2001 to 2019, there is a steady decline of e-cigarettes, of traditional cigarettes. And on the right, you can see that clearly there is an increase in e-cigarettes. And you can see what a significant jump. We're almost close to 30% of high school students now in 2019 use e-cigarettes. Now compare that again to just 16% of regular cigarette smoking of high school students in 2011. So in less than 1 decade, not only have we increased the people's use of nicotine and other products that are within e-cigarettes, we've actually doubled that usage from traditional ones, mainly because people believe it's safer. Some people believe it actually is healthy. And some people will then utilize, well, this way I don't have to start smoking regular cigarettes, but I still have other reasons why I want to do that. We'll get into it. And the reason why I point this out is if we want to deal with prevention, if you want to have the conversation with people about the potential risks of e-cigarettes, it's a little late to, well, I mean, technically it's never late, but if you really want to be proactive about it, and we're talking about prevention, you actually need to now go and start teaching at the middle school level. If 30% of high schoolers are already smoking or are already vaping, we've lost we've lost them. We might be able to whittle that back down to a reasonable number, but if you really want to talk about prevention, you actually have to go all the way back to middle schools to have this conversation, which is you think is unfathomable that you would actually have to do it, but that's actually where you're going to have to go to do the best education. So it's the pediatricians that are going to really, and parents are going to have a lot more influence. This slide, again, we talk about flavors, and the two things I want to point out, obviously the most popular flavor amongst high schoolers are the fruit flavored type. The second flavor, and I want to point this out, is the menthol or the mint flavor, and that's going to be important in a minute. Then you also have candy, things that taste like an alcohol drink, chocolate, cloves, spice. Those things are kind of much lower, but fruit and menthol and mint are the most common ones. So it does come down to flavors, and when they market the liquids to look like products that you go, oh, I actually like gummy bears. Let me taste it. And some of it's curiosity. Oh, I can't believe, does it really taste like gummy bears? So they'll buy that liquid and try it. So why are they so popular amongst adolescents? Again, flavoring is the #1 reason. Age-related curiosity, peer pressure obviously is one of them. They certainly market the devices to make them look cool. And they come in all shapes and sizes and colors, and you can do all different things with them. And again, it's advertised a healthier alternative than traditional cigarettes. So the flavors, they come in multiple flavors. Mint's actually the most popular. Now, since the FDA, since I gave a talk in 2016, that was with the year that they had just kind of came out with the FDA ban on children, so under 18, being able to walk into a store and buy them. I can't believe it actually took that long, but it did. But the two things is that isn't banned across the board is tobacco flavored and menthol flavored are not banned in anywhere. And the reason why menthol is important, or reason why they added menthol years ago to traditional cigarettes, menthol prevents the cough reflex. So when they said, oh, the menthol flavored relaxing of a Marlboro Light, well, that's because it prevented you from doing what your body wanted to do, which is cough up everything that you just inhaled. So having the menthol there prevents the cough reflex and actually increases your usage then by blunting the body's preventative normal response to that, to smoking and vaping. So those who are scoring at home or looked on your phones last night or today know that the FDA just banned Juul. And what did that mean? Well, so the ruling is they must stop selling its vaping device. They must stop selling tobacco and menthol flavored cartridges. And that's the reason why. Those on the market must be pulled and must prove their e-cigarette benefit to their public health prior to being able to go back onto the market. Now, Juul also is responsible or felt to be responsible by many, and obviously the FDA, and in their press release, that they feel that Juul in their marketing strategies have played a disproportionate role in the rise of teenage vaping. Now, the top part, I just kind of went to their website and I only cut a small little piece of what of the flavors that they had, but you can see that they had a long line of tobacco and menthol based products. And then they also, I can't even count how many flavored products that they had and the little cartridges that went with them. Okay, so we do have some known health risks. So when we say, well, is it safe? Is it not safe? There are things that we found out that make e-cigarettes actually cause damage, and that's very clear about it. So the first one, Harvard School of Public Health found that 75% of e-cigarettes were filled with a liquid containing diacetyl. And what diacetyl was at the time, that was what was used in other flavorings to help dilute the flavors that you want to get into it. And the original one was butter. It created the butter flavoring. But then they found that people who work in the popcorn processing factories that are mixing that chemical onto the kernels and in their shops and in their warehouses, they found that they were actually developing an irreversible respiratory disease that's similar to COPD called BOOT. And it was when they realized that, that's when they took and switched to a different type of diluent to make it safer for the workers. But for a long period of time, it was actually used in vaping to improve, again, the solubility for that. It has since been discontinued when this was found out with the permanent causes. But unfortunately, for all those people who were using those e-cigarettes and those liquids up until that point, there have been many people that are permanently damaged with their lungs that they're not going to get back. On the right-hand side is a picture, a cross-sectional section of the of a CAT scanner that kind of shows that information. And this was only vaping for 7 months for permanent damage. Now, the other part I want to make a point about when we talk about these flavorings. FEMA, most people think of the federal government's emergency management, but there's actually a flavor extract manufacturing association that is in charge of the safety of what gets put into foods. And they say it's a GRAS or generalized recognized as safe, but it only applies to foods. It does not apply to the flavorings that then get into an e-cigarette to then get vaporized and inhaled. It was only what was safe for baking. So secondhand smoke, I'm not going to spend that much time, but again, it is something that people thought, well, it's okay because it's not a real cigarette, so it's okay to sit beside them and blow it into your neighbor or your child or be in a car for a long period of time. But what happens is your propylene glycol and your vegetable glycerin, they get broken down to form from under heating when they get volatilized to formaldehyde and other carcinogens. There's no evidence the secondhand aerosol is safe for non-users to inhale, and 9 states actually prohibit, and actually this has now gone up higher where smoking is already prohibited. This is another thing that just occurred when we talk about vaping, that, you know, why should we let a good pandemic slow down our profits? They really started advertising to vape during COVID. If you're in lockdown, doesn't mean that you can't de-stress by vaping. And so COVID social distancing, the isolation from school, stress, poor social support, all contributed to its increased use. The false narratives for the protective use of e-cigarettes against COVID were also being exposed out there. The exposure to toxins and compounds in e-cigarettes may suppress the immune response to actually lead to increased COVID symptoms in users and non-users, and made it very difficult for some radiologists because EVALI symptoms was very similar to the ground glass appearance of COVID, but at least you can test positive for COVID, and EVALI is still a diagnosis of exclusion. So one of the main ingredients obviously is nicotine. Nicotine's found in almost all of e-cigarettes, and its range supposedly is between 0 and 3.6%. Studies have shown repeatedly that when they test the actual cartridges, what is actually the concentration that's on the label is nowhere near the concentration that is actually in the container to the percentage that you can actually say that you can trust with it. And even amongst the same brand of e-cigarettes, there can be a variation between up to 30% from different batches of the same brand of e-cigarettes for concentrations of nicotine. Surgeon General, again, this is the common sense stuff, has already said that exposure during pregnancies can harm fetuses. It can affect the brain and lung of newborns, create low birth weights and premature deliveries and stillbirths. Nicotine in the adolescents and young adults can cause lasting cognitive behavioral impairment, including effects on working and memory. Excuse me. So nicotine alone, again, will cause lung inflammation. It will cause significant deposits and increase responsiveness to airway spasm. When we talk about, well, how do you compare apples with oranges? So the amount of nicotine found in a pack of cigarettes is the amount found in a 1 Juul bar or 1 puff bar. Nicotine outside of the lungs also has significant effects. It can cause increased heart rate variability, increase those that are prone to arrhythmia. It can cause those who are prone to addiction. Nicotine is actually more addictive than heroin, and nicotine is transmitted 100 times more in vaping than in cigarette smoke. So the other contents that are there, when they looked and through those things, there's many other substances that have been found in combustible cigarettes. They're not all in e-cigarettes. That is true, but studies testing 12 brands of e-cigarettes did test carcinogens and toxic chemicals. Testing the refill dispenser of 56 e-cigarette devices detected toxic metals, including lead, chromium, and nickel. Toxic metals that become toxic, not if you ingest them, but when you inhale them, manganese and zinc. There are plenty of impurities and inconsistencies in what's in the cartridges, and recent studies have both found bacterial, fungal, and organic contaminants in both single use and obviously not surprising that would also be found in refillable e-cigarette products from multiple manufacturers. In 2015, David Christiani had said, came out and said, since most of the health concerns about e-cigarettes have focused on nicotine, there's still much we don't know about e-cigarettes. The addition of the other variable levels of addiction substance of nicotine, they also contain other cancer-causing chemicals such as formaldehyde. And at the time, they were the study that actually brought light on how the flavorings was causing boop. He actually came out with another study and this year that has basically that was in the New England Journal of Medicine. I would also recommend kind of using this to talk about e-cigarettes and chronic lung. That looking at all the other factors, e-cigarettes was the most likely cause for these people to develop chronic lung disease. Most of them were only between 3 and 8 years, and they use different devices and different vaping flavors, so you can't pin it down to one specific thing. But their lung biopsies did show small airway centered fibrosis, and even the editorial from the New England Journal of article had said that it is the first admirable step to unveiling this complex issue. There is an addiction potential at least in mice. They exposed mice to 2 tubes. One had harmless gas, one had vaping gas. They saw what, and then they set this experiment up the next day, and the same mouse ran to the vaping smoke and stayed there. So I want to speak now about the asthma risks of vaping, and if we have time, we'll go through some of the other potential health risks. But let's focus mainly on asthma and where we are today. So 13% of adults in the U.S. have used e-cigarettes, and e-cigarettes do have some damage to the respiratory symptoms such as cough and bronchospasm and asthma. Pre-existing epidemiologic results were inconsistent on whether or not there was e-cigarettes risk to asthma. That was then. We've now have jumped forward, and there is more evidence showing at least significant associations. So close to a 5,000 patient study in Korea, there was a significant association between active and passive smoking in asthma compared to the control group. South Korea, close to 36,000. E-cigarette users had an increased association with asthma diagnosis, and these are diagnoses by were not cross-valid. They didn't go back and look at all 30 in this study. Did not go back and look at all of these studies and all of these users to find out that they have a true diagnosis from a physician. These were more of forms and surveys filled out where that came from. So, but in the United States, another close to 22,000 looking at teenagers. Also, vaping products were associated with asthma. In 2021, this is also a very important paper that I would recommend those who are interested in this. He did a meta-analysis of what do we actually know. So looking at it, it was down to 11 observational studies. You might not think that that's much, but when you look at it, it is over 1 million participants. And they were looking at what is the relative risk or odds ratio of e-cigarette exposure to asthma. And this is asthma that's actually diagnosed by a clinician. So of the 11 studies, 3 were adult only, 7 were adolescents only, and 1 was mixed. There was association with e-cigarettes of asthma. There was a significant association with if you're a current e-cigarette smoker with asthma, and even a significant association of former users with asthma. So even when you stop, there's still an association with asthma. The e-cigarette users association, again, is obviously significant higher risk of asthma among the current e-cigarette users than the non-users, and the risk of asthma using both e-cigarettes and traditional cigarettes obviously escalates the odds of developing asthma is even higher than if you just smoked traditional cigarettes alone. So there must be, that just adds to, there is a risk factor for vaping and developing asthma. There's not we don't have as of yet, and I'm not going to say that there will be, but the fact that that information is there says that there's certainly enough there that I would pause and use that as an education rather than saying it's safe, it's okay, you can vape and you're going to be fine. That is not the case when we're talking about asthma. Subgroup analysis. E-cigarettes in adults actually were greater risk for developing asthma than adolescents. Not surprising, statistically, female risk is always greater than males. But in these studies, the risk in Korea was the same as the risk in the United States. So you can't blame. So in a sense, some people would say, well, there's a lot of smog in Korea. Maybe it's due to other external environmental factors, and in America we're different. Both had the same subclinical information. So the meta-analysis showed that the use of e-cigarettes was closely related to the onset of asthma, that the use of e-cigarettes among teenagers with asthma is close to 13%, which is significantly higher than those that do not have asthma. There is an indirect exposure to e-cigarettes as a risk factor for developing acute asthma attacks. And in addition to that, the propylene glycol and glycerin heated, again, forming formaldehyde, acetaldehyde, both are also risk factors for triggering asthma exacerbations. This is a simple editorial. It's short, but also is very excellent. And you have to appreciate when someone's title is Vaping Asthma Adolescents, Time to Deal with the Elephant in the Room. So it just came out in 2022. I would recommend, it's a very short read. That's another article that may be helpful in your education and goes through the different, the information in a logical way to share with your patients. Obviously, we can do more with animal studies than we can do with human studies. So the animal studies consistently show an increase in airway hyperresponsiveness and exposure to e-cigarettes. There is a significant increase in airway inflammation characterized by the infiltration of eosinophils in the blood, from the blood to the airway, an increased association of mucus production, airway thickening, and inflammatory markers. Few studies actually look at in the adolescents. There is some information from adult studies using conventional spirometry or impulse oscillometry, and found that there's an acute deterioration of the iOS parameters even after one session, and both peak expiratory flow, FEV1 over FEVC ratios are also deteriorated along with airway resistance and small airway function. Going along with that, vaping will increase the risk of respiratory infection because it impairs the function of the cilia. It reduces the sensitivity of the cough receptors. It impairs the neutrophils and the alveolar macrophage function. And it does modify genetic expression for immunologic reactions. To what extent does that lead to a clinical event? I can't say, but it does modify the genetic expression. When we talk about asthma risk in adolescents, e-cigarettes use increases the probability of asthma diagnosis in adolescents. It's found to be an independent risk factor for asthma. Vaping increases asthma prevalence in high school. E-cigarette users have a high absenteeism due to that asthma. Asthmatics have a high odds ratio for an attack from secondhand vape next to someone. I apologize for that misspelling there. E-cigarettes are linked with lifelong asthma and have a higher incidence, whether again cause, effect, or just related, have a high incidence of depression and social and social depression compared to non-users. So in summary, from asthma, the main effects of vaping on the airways: it does increase the risk of asthma developing triggers. It increases the onset of severe attacks in asthma, deteriorates lung function. It increases airway inflammation. It increases the risk of respiratory infections and acute lung injury. Now, Ivale, I'm just double checking. I apologize. Let me double check on our time. So 11:10. So we have a little bit of time. So what Ivale was, Ivale e-cigarettes, vaping. That's some will have the E there, some will have just the valet. Right, you have to remember, right before COVID, there was significant amount of events that were occurring of people getting very, very sick, and they were younger, and having these unexplained hypoxic events and chest x-rays and CAT scans that had these big ground glass, horribly looking CAT scans, and they were trying to investigate what it was. And some people thought it was related to marijuana. Some people thought it was related to some other black market clandestine labs that were making them, but it was in over 48 states, and people died because of it. And there was a lot of hospitalizations. It turns out that we think that it was probably multifactorial. It wasn't due to bacterial, it wasn't due to funguses. We do think that it probably was due to the diluent that was used. However, it was due to multiple manufacturers of those diluents that led to it. Just as it was kind of peaking, and the CDC was putting out MMRs on it and trying to figure out where it came from, was right around the time that COVID hit. And so there was an overlap of some people looking at it, thinking that was Ivale when it actually was COVID. But then once we started testing for COVID, then sort of knew what was going on with that. So some of the other issues when we talk about e-cigarettes, let's talk about e-cigarettes and pregnancy. So when a pregnant mother is vaping, that does cross over the bloodstream, and has been shown to compromise placental function, decrease blood flow because of spasm, and can increase the risk of fetal structural abnormalities. Postnatally, it does increase the risk of short-term and long-term respiratory morbidity, and there has been shown that in utero exposure to e-cigarettes increase the risk of nicotine dependency in the youth. The offspring of smoking mothers, ADHD has been associated with maternal smoking during pregnancy. Again, nicotine can be absorbed through inhalation through skin absorption, through oral ingestion, and through breast milk. And exposure through nicotine through an e-cigarette during early life may adversely affect the lung and brain development based on animal studies. Obviously, we're not going to have studies on humans, but based on animal studies, it does show that that is a potential risk factor that needs to be taken into account. So again, one of the other issues that we have is when you, as a toxicologist, you always think of, well, what is the toxin and how is it delivered? Because different toxins, they deliver a different way, can potentially cause problems. So when you, and it's not usually isolated just to one organ system. And we're finding that vaping is one of those situations that once you vape nicotine and other products into your bloodstream, it does have an effect on the rest of the body. So in 2018, they looked at the association between e-cigarettes and myocardial infarction. The National Health interviewed survey looked in 2014 and compared that to 2016. There was a cross-sectional association between e-cigarettes and regular traditional smoking cigarettes and MIs. The daily e-cigarette was independently associated with an increased odds of having an MI, more than if you were not smoking. And it was lower. The odds ratio for conventional traditional tobacco products had an odds ratio of 2.7, but e-cigarettes had an odds ratio of close to 2, 1.79. Both former and same day and occasional smokers did not have that association with the MI. So it does look like if you stop, that your risk does start to go back down. They did compare that and look at the odds. If you start adding that with high blood pressure, high cholesterol, MI, and diabetes and age, your odds will increase. Women, again, in this situation, as with cardiac disease, have lower odds. But daily e-cigarettes adjusted for conventional cigarettes, as well as all the other risk factors that I had just mentioned, is associated with an increased risk for MI. So looking at the physiologic effects of e-cigarettes and not only the heart, but the vascular side. If you look at the heart, again, nicotine will increase heart rate, will increase your likelihood of dysrhythmia for those who are prone with it. It will increase your arterial blood pressure in your central artery and your peripheral arterial blood pressure. Increase your likelihood of having an MI, increase sympathetic activity. It will decrease the repair activity because of the decreased protective effects of the immunomodulatory activity, and also potentially in some studies can actually in utero can prevent and decrease cardiac development and increase the likelihood of abnormalities. When you look at the peripheral side of things, if you look at the arterial blood flow, it will increase arterial stiffness and aortic stiffness, increase platelet activation and adhesion, increase the likelihood of thrombogenesis, and increase platelet function, which can all lead to not only cardiac disease, but potentially could lead to stroke as well, based on this type of information. So the summary, this study supported the notion that e-cigarettes pose at least some level of risk for atherosclerotic disease and all those other things that we had just mentioned. There is significant umbilical and uterine artery blood supply restrictions from e-cigarettes in mice, and at least some level of risk of endothelial and platelet function malfunction, actually. So they would be unable as a safe smoking. So with that, I will stop. I did leave some time for questions. We could, if you wanted to, talk more about some of the other factors that e-cigarettes have with regards to how marijuana is now affecting the use or anything else that people may want to address.
So we have time, I think, for one question because we want to get started promptly with our poster presentation. And we will also give some additional time at the start of the lunch break to the poster presenters in case folks want to listen in while you're prepping your food. So we have a couple of questions. We have one that came in the event chat, which I think we partly answered, but I just want to make sure it gets read out. While flavored e-cigarettes may lure in new audiences like children and adolescents, which is problematic, would you say that tobacco flavored e-cigarettes are a viable alternative to help people reduce cigarette smoking? And then we have Dr. Weiss following up in the speaker chat saying it took about 50 years from the Surgeon General's report that cigarettes were a carcinogen and a health hazard until public places and housing became tobacco free. How can we address the dangers of vaping through advocacy and legislation? Outlawing the purchase by underage youth was a start. What is the next move? So we want to touch on those briefly. We've got just a couple minutes before we got to get started with the posters.
So I would say three things. I think, again, it's very difficult to compete with the marketing advertising of the makers. But as health advocates, as physicians, as respiratory therapists, as pulmonologists, what we can say is do not think that they are safe. They may be potentially safer than cigarettes as far as some of the carcinogens, but it doesn't make them safe. We don't know what we don't know. And I will tell you that the amount of information that we've learned in the last 5 years is purely based on the years of people using it. So unfortunately, by the time we get to the point that we can say with certainty, theoretically, that e-cigarettes are harmful and they cause X, Y, or Z, and some of those events are permanent, say asthma, heart attack, stroke, birth defects, all those things, the countless people that have been exposed to it are going to be innumerable. So I do think that the research will be getting caught up. We are now having some things that have been in place. The FDA, so last night's announcement from the FDA was the first really hard stop with that production. And I think that hopefully that will lead to others restricting those issues. But I don't think we can wish it away. But I do think that that we would be naive to think that it's perfectly harmless to do it for the person who's using and the people around them consistently.
Great. So we do have to transition now. Thank you, Dr. Dougherty. And for people who want to access Dr. Dougherty's slide deck, that is now available on the site if you refresh the agenda and hit that download PDF button. You can also